From your Gulf Coast Weather Authority, this is Fox 26 News at 5.
Breast cancer is the most commonly diagnosed cancer among women, but it's not at the top of the list for taking our lives. I'm Emily Aiken. I'll continue my series on Women Take Care right after the break.
Well, we women are so busy taking care of others in the family, we often forget to take care of ourselves. Many of us think we're invincible, but we're not, are we, Emily?
No, we're not at all, Melinda. Yesterday, we looked at heart disease, which, as I said, is the #1 killer among women. So tonight, we're going to look at #2 and #3, cancer and stroke. Breast cancer is the most commonly diagnosed cancer among women, but it doesn't top the list of cancers responsible for taking our lives.
Do you still smoke? Well, ponder this. Lung cancer, not breast cancer, is the #1 cancer that kills women. Lung cancer is #1, followed by breast cancer, then colorectal cancer, as the 3 leading cancers to cause death. But with early detection, you've got a chance at beating it. That said, why do we hear this?
I would say 20–25% of women that they know they should get care, but they delay it.
As a surgeon at Women's Hospital of Texas, Dr. Schroeder could write volumes on the excuses women have given her for not coming in for their checkups.
They feel guilty and, they come to me and they say, oh, I'm sorry, I haven't been here. And they're almost afraid to acknowledge that they have not taken care of themselves.
We're also afraid of what the doctor might find, even more frightened at the possibility of surgery.
But a lot of the fear factor has been removed with surgery because of medical technological advancements. For example, I'm looking into a camera that is used for surgery. It's a laparoscopic camera, and it's very, 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 very small.
And small cameras like this one are used more and more for female surgeries.
One of the alternatives, I tell them, is these new minimally invasive procedures.
Fewer complications, fewer scars, and easier recovery. But you've got to get to the doctor first. Dr. Domino remembers one of her breast cancer patients.
It's something that I think I will never forget.
The patient waited too long to see the doctor.
When she finally came to see somebody, she actually had something growing out of her skin up near her shoulder.
Only a few months later, the patient died.
Had she been coming in earlier, maybe we would have caught it on a mammogram.
All I did was work and take care of kids. I smoked. I didn't exercise. I never took care of myself.
45-year-old Melanie Fleck never thought she'd be the victim of a stroke. Guess what?
I was at work and I had a horrible headache all at once. Felt like somebody had punched me in the back of the head.
A blood vessel in her brain had burst. Melanie was having a stroke. Fortunately, she got medical care immediately and fully recovered, as you can see. But it was a huge wake-up call, one many women don't get.
60% of the deaths from stroke are in women, so actually more women than men die from stroke.
As a radiologist, Dr. Robert Case sees lots of strokes, too many.
The darker color is actually a part of the brain that has died, and because the blood vessel that supplied that area got blocked.
He and neurosurgeon Dr. Imran Fayez are part of the team at Kingwood Medical Center, working hard to save lives and educate women about stroke.
We're trying to label stroke as a brain attack to make them understand
it's equally as traumatic as a heart attack, and when it comes to symptoms of a stroke, it makes no difference if you're a man or a woman.
Unlike heart disease, the symptoms are quite similar in men and women. The symptoms of a stroke in a woman are almost the way they present in men.
Those symptoms are numbness, altered speech or mental state, severe headache, and weakness. Like cardiovascular disease, a stroke can be prevented by lowering your blood pressure, watching your cholesterol, getting exercise, and medication. And there is one more similarity.
I think stroke, just like heart disease, still is associated as a man's disease.
But remember, stroke kills more women than men, and African American women are even at a greater risk of stroke than other ethnic groups, Melinda. So tomorrow night, I'm going to take a look. I'm going to gather 3 women together, all of whom ignored warning signs for cancer, for stroke, and also they didn't take care of themselves, and they ended up in the hospital.
Wow. The numbers, and when I think of stroke, I also, besides thinking of men, I think of older people. But then we saw the women you profiled in your story, and that's not always the case.
That's a really good point, and I'm glad you brought that up. person's disease either. Although, you know, more older people have stroke than younger people, it is not just limited to the elderly. We have to watch it ourselves.
Yeah, we got to take care of ourselves.
Yeah.
I was also thinking, as I was yesterday, thinking throughout your story, you know, we can be so fearless as women with so many things that we're willing to take on, but there's a fear there about going to the doctor and hearing what the results, what they may be. And
you just have to do it.
We got to get over it.
Yeah.
And have you made your appointment?
No, but I will. I promise.
The countdown is on, Emily. We're going to check in tomorrow.
I will.
All right, Tom.